Hi, my name is Dr. Jesse Schulz. I'm a physical therapist in McWanago, Wisconsin. I'm going to be doing a very short, quick video today on how to do some rotational strengthening with barely any equipment at home. All you're going to need is a piece of resistance tubing or TheraBand and some sort of cane, stick, dowel, or any sort of broom or mop that you have. I would take off the head of the mop just because otherwise that might get a little bit dirty. And what you're going to do is if you have just a band, you're going to tie the band in a knot at the end. And if you have the tubing, you're going to somehow have to find a way to attach that to a door or stationary object. And then what you're going to do is you're going to put your stick, cane, mop, broom, handle, dowel, whatever, through the other end. I like using a cane a lot because it's got the hook, so I don't have to worry about this slipping off. Now, what we're going to be doing is holding a squat or holding a lunge at first when we're doing pushing and pulling. When we're doing this, it's going to be training the muscles that control for rotation around our spine, activity that's not usually done during most people's workouts, but is very, very functional for everything that you do throughout the course of the day because rotation is very much involved with everything that we do. And I'll be showing you how to do that in just a moment. I would encourage you to do 2 to 3 sets per side. And if it's too easy for you, you can always get a stiffer band. Or if it's too easy for you, instead of having your hand very close to where you have the tubing or band, you can always move yourself a little bit further away. This little distance right here can magnify the intensity of it by quite a bit. So a little bit of resistance goes a long way with this. After I show you how to do the pushing and the pulling with this, what I'll show you how to do is a little bit of a resisted short walk, just because this won't be able to stretch very far to do a long walk, but it'll still be pretty effective. So what I'm going to do first is I'm going to attach this in a doorway. I like closing it in the doorway because you don't always have one of these handles that's like an arm. And if you have just one of those typical circle handles that you grab on and turn, it doesn't work as well. So I'm going to put this through here, but for anybody thinking I don't have anything that's curved, it does work if it's not curved, so I'll actually use the other end. So I'm going to hold on to my stick here. I'm going to step forward to build a little bit of tension in the band. I'm going to push forward and let it come straight back. The band, typically, if you put too much resistance on it, will want to kind of pull off to the opposite side. So make sure that you push whatever you're holding on to exactly straight forward and exactly straight back as you're doing the pushing and or the pulling. You'll want to do this to both sides 10 to 15 times, 2 to 3 sets, 2 to 3 days per week. So I, of course, would also switch and do this on the opposite side. Pushing, pushing again. And then after I'm done with the pushing, I would do the pulling. When you're doing the pulling, make sure that you're pulling using your shoulder blades. Your shoulder blades are coming back in together as you're doing this. For all of these, you want to make sure that your chest is up. You want to make sure that your pelvis and your sternum, kind of like if you had a belt buckle on, and the breastbone are always looking straight ahead relative to where your feet are pointing. So if your feet are both pointing in this direction, your belt buckle, if you were wearing one, and your sternum should both be facing in this direction too, just smack dab, looking right down the middle of where your feet are. You don't have to have your feet shoulder width apart and exactly even with one another. You can put one foot forward and one foot back, and if you're going to do that, make sure you switch your feet. Now, so I showed you the pushing on both sides, the pulling. I'll show you the pulling on the other side too so you can see it a little bit better. Make sure again that you're pulling it straight back, your chest is up, and if your feet are shoulder width apart, I generally encourage you to bend your knees a little bit as if you're doing a squat. And if you're going to be doing a squat, make sure that you stick your butt out behind you a little bit as if you're kind of going to sit into a chair. It activates the back and butt muscles a little bit better. The last thing you can do, as I mentioned before, is a resisted walk. You're going to hold on to this. It doesn't matter if your arms are straight or in close to you. The way that you modify the resistance, the easiest is just by going further away from the band for making it harder, or closer to the band for making it easier. You're going to hold on here. You're going to take a couple steps. Then you're going to slowly come back. And if you feel like your shoulders are turning towards a band, or if your pelvis is going to either side or pivoting in an odd way, then you have too much resistance, or you need to get closer to the band to decrease how long of a lever you're using to try to impart some rotational resistance with this. After you do it to one side, do it to the other, and then you can also do it backwards. But it's the exact same idea when you're doing it backwards. I hope this helps you out. This is a great exercise that anybody can get benefit from at home, whether you have knee problems, back problems, hip problems, a fantastic exercise. If you're undergoing ACL rehabilitation and you are not supposed to be pivoting, but you need to work on those rotational components of your strength, this is also a fantastic exercise. Thank you for watching.